That makes a lot of sense, Maggie. And I'm actually going to dovetail into a question that was sent in earlier by an anonymous student. I'll just read it point blank. I think this kind of dovetails to what you were just saying. So looking back when you made your decision about different graduate schools, Maggie, is there any reason that you wish you had, any resource that you wish you had to compare schools, and is there anything that you would have taken into consideration more heavily now having gone through the process?
That's an interesting question. So I do think that there are things I would have weighted a little more heavily. However, I don't think I would have ended up making a different decision than I made. So I ended up, I sort of over-applied to schools. I found that that's one resource that would have been really helpful, is just sort of getting a feel for what sorts of qualifications are needed for various schools of varying ranks. It was really difficult for me to find that information, so I just applied to many, many schools. And in the end, I ended up narrowing it down to 3, and I visited 3, which might have been a little excessive, but I did feel like visiting was really important, and that was something I got a lot out of. Some of the things that I looked for when I did visit schools, when I got down to that sort of final 3, final 2, I think for me what was really important, and what I think I would weight even more heavily now, is looking at a school that's going, or a program rather, that's going to give you the skills that you either want or need or have been told that you will need for the particular profession you want to pursue, rather than looking at topic areas. So for me, I knew I wanted to do practice and not research, but it's really easy to get caught up in looking at various schools what professors are doing research in what topic areas, and to kind of be drawn to that. And it's fascinating, and they'll teach classes on it, and you'll eat up your coursework. But what I ended up sort of choosing, and what I'm really grateful that I chose, is a route that is giving me a little bit better foundation and sort of broad public health work, and skills for doing various things like evaluating programs or designing programs or things like that, that could be applicable in really any variety of like public health topics. But if you're more interested in research, then I think it is really important to kind of look more at topic areas and what's being covered, because the practice-oriented stuff isn't going to fit as well. So I think that's something that is really important to pay attention to. And then I think just, this is so trite, but really just getting the feel for like how you feel at the school. And I don't think I weighted that very heavily because I thought I could sort of survive anywhere, which is certainly true. But I really felt a connection with the faculty at the school that I chose. And I really got the sense that the students there, the current students at the time, were really happy to be there and were really getting a lot of the experience. And that wasn't something that really shone through as much as some of the other schools. And so I think for me, that was something that was really important and sort of has continued to be the case. I'm currently a student there, and I'm meeting incoming students and feeling sort of the same way. Like, I'm really happy with my choice. I'm happy there, and the faculty are still reaching out, thrilled about getting to know students, and that's something that like continues to really influence my experience.
Right. That's really great. Let's sort of transition into sort of the med school field. So, John, we'll start with you since we have 2 med students on the call. As I know you've just kind of dovetailed with Maggie a little bit, I know you've expressed a lot of different avenues that you could take into including global health into medical school, and I think it would be really interesting to hear how you plan to shape your experience at Boston. Could you elaborate a little bit more on what you're thinking as far as a gap year, for example?
Oh yeah, absolutely. And one thing too, just to touch quickly on what Ron said, when he mentioned Chicago, and is just wherever you do go in terms of different graduate programs. I think it's obviously learn about the school and everything, but also consider the city, like the setting that you're going to be in, because that's really something I didn't really sort of appreciate before I got to Boston, was just being in Boston and being in Massachusetts with all the health reform that they've done. You can really learn a lot, and there's also a lot of opportunities that I can pursue outside of BU specifically. Partners Health is obviously based here, and so just going to different talks and Harvard or different places has been a very valuable resource. As for global health and medical school, I mean, I think sort of, you know, when you think of like medical school and residency, you think of this like 7 to, if you want to be a surgeon, you know, 12-year training program. That seems like, oh my gosh, I'm going to be 40 and then I get to do global health. And I think you really need to sort of modify the focus and realize that it's, you know, this is a lifelong calling for us. Like, it's not really, you know, we use the word vocation usually instead of a career. And in doing so, I think it's important that in all of our activities, we sort of we should strive to incorporate global health work in some aspect of that. So in particular for me, in the first 2 years of most medical schools, you have introductory clinical training where you learn basic history taking and physical exam skills. And unfortunately at BU, they had an opportunity where you can do all of this training at a community health center. And so I've been working at the Community Health Center in South Boston for this whole year. I'll do so next year as well. And then in my third year during clinical rotations, I'll also try to incorporate a lot of my outpatient work into that setting. So I also considered doing the gap year thing, and just sort of when it came to it, I just decided, you know, let me go to medical school, and, you know, and just in my past year, you know, I really learned, you know, a lot more about the U.S. healthcare system in particular, and that's definitely shaped what I think I'm going to do in between my third and fourth year. And so some of the opportunities I think definitely are doing the MPH, and then you know, potentially even doing the MBA, like Divya said. Some of the other opportunities more potentially I could do a Fulbright, or there's even, I was actually looking this year, the Global Health Corps. They actually have a fellowship just outside Boston here in Dorchester. And so working with the PACT program through Partners in Health. And so we'll see. I mean, I think it's, you know, during medical school right now, I think I want to try and develop as many skills as possible. And then once I'm done my training and residency, then I get to practice and like sort of really get out there. And so doing the MPH now, I think, would probably be most beneficial. And I think that's sort of where I'm leaning. And I think also to, you know, sort of follow, there's a balance between, I think, like we always want to like do what's useful and like do what's needed. Like at least when we say design like a health program, we don't want to go in and do some sort of outreach that isn't necessary to the community. But I think that you have to balance that with what you wanted to pursue as, you know, your own personal career. Right. You know, and so for instance, like if you want to do an MBA, that's great and like obviously very valuable. But at the same time, like sometimes I'll look at like the curricular for the MBA and it's, you know, versus say the MPH, and the MPH is just way, way more interesting. You know, and so I think balancing what's needed, but also really sort of finding your passion and really putting throwing yourself into that. And I think that can be, you know, the way you can be most effective. So that's sort of where I'm at right now.
That's a great summation. John, I also remember we had a conversation about this a couple weeks ago or so, but the different options for pursuing an MPH in med school, for example, it doesn't necessarily have to be completed during a gap year, but there are opportunities, in, for example, an internship or in fellowship after medical school, and sometimes they're paid for during that time. Do you have any thoughts on those experiences?
Yep, yeah, totally. So, so you can do it between the gap year, and then the downside of doing it during the gap year in a sense is that usually you have to pay for it. We get some, at least at BU specifically, we get some scholarship credits, but not totally. The benefit also is it is 1 year, and we do get some of our med school courses that count towards it. Alternatively, I could do it at the end of residency. You could even do a residency in preventive medicine if you so choose. And that would be, say, an additional 2 years on like a typical 3-year primary care residency. And then in those cases, yes, you can do like a fellowship and it can be paid for. You know, and so I think there are totally tons of pluses and minuses to it. I just sort of think by the time, say, I'm a third-year resident, I'll be 29-ish, going on 30, and I think at that point, after 7 years of schooling, I think there's going to be a strong desire to get out and like sort of really like be seeing patients full time. And so I think that's sort of why I'm still in school now. I think like at least from people I've talked to, it's like, you know, I'm still in school. It won't be too bad to sort of stay in school for another year. But I think to go to residency